Good morning. Okay, it's a health conference. You're supposed to be healthy. Good morning. All right, let's get some energy going there. Anyway, as Barry said, I'm Ned Massee, and it's my distinct honor and privilege to be chair of the Virginia State Chamber this year, and we take it with great pride in being involved with this wonderful organization. But we're here today to seek new innovations in healthcare that will help Virginia achieve healthier citizens, healthier communities, and a healthier economy. As chair of Virginia's largest business advocacy organization, it is my role to remind you all of something you already know. Healthcare has a huge impact on the economy of the Commonwealth, and the health of Virginia's workforce impacts our economic competitiveness, business development efforts. Employers of every kind and size have to get engaged in the effort to maintain a competitive position and a productive workforce while also managing the challenge of unsustainable increases in healthcare costs. That's why the Virginia Chamber hosted the first annual Virginia Healthcare Conference last year, an event that marked a milestone in bringing together providers, insurers, and businesses to share best practices on building a healthier workforce. Over 500 individuals, as Barry said, from the employer and healthcare communities attended last year's conference to discuss the need for innovation in healthcare and how to ensure a focus on value-driven care. As a result of the conference, the Chamber has created a healthcare committee to provide a forum where employers can provide health care reforms, support innovation, and promote wellness initiatives throughout the Commonwealth. The committee, led by Bob Kramer, manager of HR services at Norfolk Southern, serves as a collective voice for key stakeholders and is enabling employer engagement into the healthcare discussion. We're grateful for Bob and his leadership, and you'll hear more from him later today about the progress of the committee. The Chamber would also like to thank our partners in the healthcare community for joining forces with us on these important initiatives. It will take all of us, providers, insurers, and employers, working together to pave the way for success in health reform. Perhaps no one has played a more important role in bringing the business community in the Commonwealth to the table in health reform efforts than this morning's featured speaker, Virginia's Secretary of Health and Human Resources, Bill Hazel. Secretary Hazel has been instrumental in working with us in the creation of the Virginia Healthcare Conference and continues to provide guidance on our programs and initiatives. On behalf of the Virginia Chamber, Bill, and our 13,000 members, we'd like to extend to you our deep gratitude for your support and leadership. We're all well aware of Secretary Hazel's outstanding leadership in working to ensure every Virginian has access to appropriate and affordable health care. But as a result of an announcement yesterday, I can't let the moment pass to not also recognize his being a longtime orthopedic, and he also helped keep those joints and bones available for the Washington Redskins on a regular basis in those years in the past. So Bill, we appreciate that, as Richmond appreciates them coming to the area. Although Northern Virginia, I drove down from Northern Virginia this morning, Loudoun County has a different view on that, but Richmond is very welcome and open to the Redskins coming down. As Secretary, Dr. Hazel oversees 12 state agencies with about 15,000 employees and includes such diverse programs as Medicaid, behavioral sciences, social services, as well as aging and disability services. These combined agencies are approximately 1/3 of Virginia's budget. Among his accomplishments thus far include the Virginia Health Reform Initiative, negotiation of an agreement with the Department of Justice to improve services for individuals with developmental disabilities, and initiation of enterprise IT system transformation for health and human resources in Virginia. Secretary Hazel has been charged by the governor to go beyond federal health reform and recommend other innovative healthcare solutions that meet the needs of Virginia's citizens and government. He is here today to update us on these initiatives and more, and including the newly launched Virginia Center for Health and Innovation, which he chaired. Now, with a large group like this, I'm going to make Barry nervous because this is when I go off the agenda, but I can't pass the opportunity. This is a major election year, As you all know, we're going to be electing a president. We're going to be electing a new senator from Virginia. We're going to be electing 11 members of the House. We'll have a constitutional amendment. We'll have a number of local races and such to consider. I just encourage us as a large body to get out and vote. But part of that, be sure you're registered to vote. Most of you probably are, but if you haven't taken that opportunity, please do so. And if your colleagues aren't, please reach out and help them get registered. And then the other problem is being sure that you're available in 151 days when we will be going to the polls on November the 6th. And if you know that you're going to be out of town on that day, please think about casting your ballot absentee. Because remember, one vote can make a difference, and if you do not vote, your vote ceases to exist. Now, enough with my little diatribe, but anyway, let's welcome my good friend, Bill Hazel.